With respiratory viral season in full swing, let's talk about a drug that's indicated for infants to protect them from RSV, and that's Enflonsia, also referred to as Clesrovimab, and this was approved just earlier this year in the summer of 2025. And again, it ends in MAB, so therefore it is a monoclonal antibody. And it's used for the prevention of RSV in infants, and that's very similar to another drug that I broke down a few years ago called Beyfortus. So let's compare the two. Beyfortus is a weight-based dosing, so if an infant weighs more, they'll receive more of the drug. However, Enflonsia is a fixed dose, so regardless of the weight of the infant, they're going to receive the same amount. Both Beyfortus and Enflonsia target the RSV F protein, but in slightly different locations. And Beyfortus, it can be used for high-risk infants even past the first RSV season, so it could be given a second or a third time, whereas Enflonsia is just indicated for now for infants during that first RSV season, but that could change in the future. But before we talk about how Enflonsia actually works, let's zoom in on the immune system to better understand what should be happening during an infection. Now, B and T cells of our immune system have that memory against prior infections, and it's our B cells specifically that produce protective antibodies that can go on, target that infection, and kill it before it has a chance to make us severely sick. However, infants have a very low immune system, but they're at high risk for RSV. So therefore, they need a supplement in order to boost their immune system to protect them against this virus. So when Enflonsia is used, it's a short-term protection, about 6 months, that's directly providing them those protective antibodies. So you can almost think of this like a substitute for their immune system, giving them the protection that their immune system should be making while they have a time to grow and develop that immune system on their own to protect them in the future. So when Enflonsia is given, it's able to bind directly to the F protein on the outside of RSV, neutralizing it and destroying it before it has a chance to make the infant severely sick. So if you have another drug that you want to learn more about, make sure to stay connected to my channel and with Dane Garvin by dropping a comment below on that topic.